Good morning, and welcome to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
And we welcome you to Talk of the Town for this Friday, April the 24th. I'm Gary Stevens. We'll be open line following the 10 o'clock news. About an hour from now, Patty Vandenberg will join us. What's new around Holland? We'll be joined by Alyssa Lanyons from the Day Center of Evergreen. But in our first half hour, we are pleased to have the Director of Emergency Management Services with the Ottawa County, Nick Bonstell, on the other end of our Zoom connection. Nick, good morning. Glad you're able to join us on WHTC.
Thanks for having me, Gary. Glad to be here.
Glad you are with us this morning. And of course, if you have questions, we are on a Zoom connection, but you can't join us on the Zoom connection. You join us on the usual 395-1450, 395-1450 to talk a little bit about the Emergency Management Services Department, how it is responding to the emergency that we are in right now. Maybe not what was expected, Nick, when we're dealing with emergencies. Usually it's more natural disasters, maybe an occasional man-made disaster such as hopefully, terrorism or stuff like that. This one, I have a funny feeling, hit everybody up the side of the head a little bit, even though we got the warning signs back in late January about this being in China, trying to keep it there. It didn't happen, and everybody around the world's got it now.
Yeah, it definitely is a different type of crisis to respond to for sure. But, it's kind of funny because when you're looking at emergency management, even the same principles still apply for the response. So, just getting goods where they need to go, getting people on the same page, creating the same common operating picture amongst all of our jurisdictions here in the county. We're talking a different talk with pandemics for sure, but a lot of the same principles still do exist.
Peg McNichol has a question from the WHTC newsroom. Peg?
I actually have two. The first one is, at this point, I am looking at Ottawa County numbers and I'm seeing a rise in numbers. Is there any better idea of when we might feel the surge, or are we in it now? Is it weeks away? Where are we at?
Well, Peg, that is the $1 million question. And if you had the answer to that, we should be getting you out on every single talk show out there. So
I have all the questions, none of the answers.
That is the hardest thing to try to figure out right now. And what we do is every Monday, Wednesday, and Friday morning, we have Eeoc Briefing, and we have about 110 different stakeholders throughout the community on this briefing. The one person on there is a senior epidemiologist with Ottawa County Department of Public Health. And basically, that's what they do. They break down that data for us and kind of give us a good idea of where we might be. And really, no one can tell you exactly where we're going to end, but they are pretty all much on the same page that we are on a plateau, and we are really to a point where we're manageable in our response. It's not anything that's overwhelming the system currently. We feel like we have good protective measures in place. If we do get that surge, we're ready. We're ready and staffed, and our hospitals are ready to respond. So without telling you exactly a date and time of when this thing might end, we just know that, where we're at in it as far as preparations. And we're ready if we do get a big surge. But as of right now, the data seems to be inclining with the amount of available testing that's out there. So that's a good thing. The more testing we can get out there, you'll see those numbers continue to rise, and the more pinpoint they can actually get with where the spread is in the community.
Can you say about how many tests that we've done in the county so far, approximately, and what's the likelihood that we will get enough tests into our county? Both, I know you can't speak for Allegan, but just in general, I know the issue seems to be consistent across all levels. There are literally not enough test kits. Are we getting enough? Do we need more? And how many are you able to do a day?
Yeah, and those are all really, really good questions. So Ottawa County Department of Public Health actually maintains those numbers. So I actually don't have in front of me exactly how many of those tests have been ran through the county overall. I do know that you are 100% correct in saying that what's holding us up as far as getting more testing out there is availability of some of the equipment. So that it's not the entire kit itself, it's specific items like swabs. You've probably heard that from the president on a federal level talking about swab production and trying to get those out to the states and then down to the local jurisdictions. I will say that statewide, we have gone from hundreds of tests to processing up to 9,000 tests a day as a state, and that's a pretty big increase. And really, when you look at the numbers and you look at them, where they're at, and you look at how many tests have been available over this period of time, it's good to see that increase in testing capability for sure, as not only a county but a state.
Hold on a second, Peg. I'm going to get to a call. Good morning. You're on the line with Emergency Management Director Nick Bonstell.
Good morning. If you watched President Trump yesterday, they had charts showing that sunlight kills this virus, and not only kills it, but UV light, heat, humidity. And I just wonder now, being that we're having sunshine, warmer weather, hot weather, this may all go away. And I just think that we have to open up Michigan and let people get back in their boats in the sunshine.
Mm-hmm. All right, appreciate the call, Nick.
Well, one, we are all looking forward to sunshine. I know I, in particular, am looking out in the future of getting out into some sunlight. The thing with the sunshine, though, I'll start with the UV. So the UV light definitely is a procedure and process that we have started to use within the hospital systems, and it will probably get out to emergency services here in the near future to sterilize medical equipment and sterilize PPE to extend the life of the PPE. So we have found that UV light does work to disinfect and sterilize certain pieces of equipment. As far as the sunlight and warmer weather goes, there's not a lot of study out there as far as exactly how much decline that will give us. It will definitely never go away in the summer. There will always be some sort of community impact throughout the summer, whether that's less because of warmer temperatures or not. That's still being studied. When you look at places like Africa and California, the places that have large amounts of sunshine, they're still feeling the effects of community impact. So sunlight definitely plays maybe a little bit of a role, but there's a lot of studies that have to be done yet as to what extent that does play in this.
He is the Director of Emergency Management Operations for Ottawa County's Sheriff's Department, Nick Bonstell. If you have a question for Nick, you can ask him at 395-1450, 395-1450. Peg, you had another question? Go ahead.
I have another question. So one of the things that was brought up, I saw on social media, people are like, well, we should have a better supply chain. Why don't we get like the National Guard or the military to come in here and make sure, there's milk getting to restaurants or farm to table stuff going on. And I know there are dozens and dozens of ways people are trying to get food to families who haven't been able to get a check yet from unemployment, or they're just broke right now. So what is the plan as far as feeding? Are you guys working with some sort of military thing as far as like fixing the supply chain for food for folks?
Yeah, there's actually a couple pretty good questions that got wrapped up into one there, Peg. So first is the National Guard is being used here in the state of Michigan for response to COVID-19. And they are actually being used in logistics and supply chain management. So that was a good thought there from that person with that question. We are actually using them in that capacity currently on this response. As far as the food stabilization and food supply chain management goes, especially here locally in Ottawa County, we have a tremendous network through our human services seat within the EOC. There's a gentleman by the name of Patrick Sisler who organizes an organization called Community Spoke. There's like 84 different human services agencies that all coordinate through that process. And one thing that we've seen is a great coordination here locally, and definitely making sure that the food pantries stay full, that the use is being looked at on a daily basis, and making sure that those things don't run dry so people don't go without meals. And what we're seeing, quite frankly, from a supply chain, especially on food on our side, is that is a supply chain that is actually quite strong compared to our PPE supply chain. So we're not seeing any big decreases in food supply. We're seeing that people are definitely getting that need fulfilled here at the county. And there's also things happening at the state and federal level to make sure that that continues to happen.
If you got a question for Nick Bonstell, Emergency Management Director for the Ottawa County Sheriff's Department, I'm throwing titles and I apologize, but they're all pretty much in the same boat. 395-1450, Peg.
While we're waiting on the next call, let's talk about a health person, not Rob Davidson. Gary thought it was him. I'm not using this person's name, but we were going back and forth talking about being out grocery shopping, which I did for the first time in 3 weeks. And I wore a mask and gloves, but I saw about a third of the people without any masks or gloves, all ages. In some cases, one partner, like a couple, would come in the store. I didn't see lines to get into this large store. There didn't seem to be any of the spacing that's required by the governor. So what is the outlook right now? Is it okay to go out like that, or is it really something that we should all be masking up and gloving up as we go out? What's the story about that?
Yeah, so here's the thing, as far as direction with going out in public and wearing masks, and what you see from a CDC and a national level directive from the federal government, and this is probably the hardest thing that people really have a hard time grasping is when you're out in public and you wear the homemade mask. Number one, please leave the medical equipment, the N95 masks and the surgical masks, to the people who are out in the field dealing with COVID-19 patients on a daily basis. So when you look at a homemade mask, for instance, you're not really wearing that for yourself. You're wearing that to protect other people in the store. You may be a carrier who's asymptomatic. You have no symptoms whatsoever. You don't even know that you're carrying the virus. And you accidentally have a transmission, whether it be through airborne particles, a sneeze, a cough. All that mask is doing is keeping that to you, so you don't spread it to other people. So what I try to explain to people is if you do go out, especially right now, public health is very clear that you should probably put on a mask and think about the frail 80-plus patient, 80-year-old person who might get it from somebody. And you don't want that person to be you. So really, we do advise to wear a mask if you're out in public at this time due to the community spread, and just making sure that we're keeping the people in that vulnerable population safe as we move through this.
395-1450. You have a question for Nick Bonstell. He'll take it at 395-1450. Speaking about the equipment, and we earlier this month and late last month were talking about the need for getting the emergency equipment you guys need and first responders need the masks into your hands. How has that response been? Have you been able to get the equipment you need to effectively deal with the situation?
Yeah, I got to tell you, I cannot say enough about our team and the ability for them to rise to this situation. And all hands on deck over the last 3 weeks trying to get the needed personal protective equipment out to those first responders in the field who need it. They need to stay protected. And like Gary, we talked about this before, but we start to lose our fire service, our EMS services, our law enforcement services. There's nothing there to really, shore that up and come in behind that service. So it's critically important that we keep those people protected. So over the last 3 weeks, man, we've had such a rush on community donations, all the way from, 1 or 2 masks from a person to hundreds of masks from a company. On top of that, we have received here within the county, our fiscal services and our logistics section have done awesome at procuring from different vendors and making sure that that stuff stays within that supply chain. And we are actually to a point where we are very comfortable with where our personal protective equipment is for our first response agencies. So a lot of hard work from a lot of people over the last 3 weeks, but we are very comfortable compared to where we were 3 weeks ago.
Good morning. You're on the line with Nick Bonstell.
Yes, according to the CDC in 2017 and 2018, people died of lower respiratory infection. Could it be that now they're actually dying of the COVID-19 and that the coding that the CDC does is inflating these numbers?
Yep. So once again, we work very closely with Ottawa County Department of Public Health. And the Department of Public Health is the lead response agency, and they're the ones who basically are the ones who report the numbers and report the criteria for the numbers. And they've created an awesome GIS dashboard that you can go to MIOttawa/MyHealth to view, and it keeps all those little pieces of data up to date throughout the course of each day. As far as the framework of what's included in those death reports and those numbers, obviously that's a directive that's pushed down from the federal government to the states and then to the local levels. So we basically follow exactly what the federal government requires to be put into those numbers. So as far as inflation in numbers, I don't think there's any inflation of numbers going on. However, there is a term that's called comorbidity, and there's definitely comorbidities that are added into those numbers. So anyone who basically dies of COVID-19 is a COVID-19 death, but you're right. There definitely may have been an underlying health condition there as well, and the majority of times there is.
Appreciate the call. Thank you very much. 395-1450. Peg?
If I can just offer something clarifying, I have seen this story go around about the 2017-2018 flu season. It's been misrepresented. There was a very severe flu season. Some people are saying it only affected certain ages, but it actually was across the board a severe flu season. However, it's also true that we have had more COVID-19 related deaths since this whole pandemic started here in Michigan than the entire flu season since last fall. Typically it starts in October. The first death was, I believe, flu-related death was November 1st. So nationwide, we've had more COVID-19 deaths than the entire flu season, and I believe we're close to that or exceeded that here in Michigan as well. And that just it speaks, I think, to how aggressive the virus is. And we've talked to people who've had it and survived and had to get hydroxychloroquine as a last-ditch effort.
Yeah, absolutely. I mean, there's definitely no doubting that this is a real thing and that this virus definitely had an impact on our state and continues to have an impact. I think one of the really bright, shining parts of this response to this, though, has been the community's effort to assist their neighbors. And for me, that has been one of the things that I definitely look at as a bright spot. I think, Gary, I talked about this last time I was on your show, but crises like this bring out the best in people and they bring out the worst in people. And seeing the best is really, there's a lot of good that's going on in this community right now that may not be hitting the news. It's just a good community effort.
Let's get one more call before we have to take a break. Good morning. You're on the line with Nick Bonstell.
Good morning. I got a question. Let's say I'm asymptomatic and I don't know it. So how do I feel safe going around other people?
So that is actually exactly, that goes right back to our earlier question of should you wear a mask when you're out in public? And I would say that this is probably where the majority of our public sits right now, is we treat, at least from an emergency response perspective, we treat everyone as if they're an asymptomatic carrier. So that way, if they are, we're already there and ready and protected. And if they're not, then obviously we've just protected ourselves to a point where knowing that if we did come in contact, we would be fine. So I think the 2 points that you bring up there is why it's so important that we continue to increase our capacity for testing. So the more people that we can actually test and get to realize if they are an asymptomatic carrier, that really helps with looking at where we are as a community response front, and then also helps us to define, how far that community spread is. Once again, Ottawa County Department of Public Health is the lead response agency, and they follow up on each one of these cases and try to determine exactly how far that community spread has happened. So your point is well taken. The best thing that you can do is proactively protect yourself and proactively protect others. And that's really where we're at in response to this right now without an increased amount of testing.
Well, say they start relaxing, where things start opening up. And I'm still asymptomatic, but I don't know it. And so they start opening things up. So then you start spreading it all over again.
So, and I think that's the big unknown that is going to be tested here in May. And what you're going to see is you're going to see one of two things happen. you're going to see either an uptick in community spread and cases. And if that's the case, then obviously there's going to have to be some response situations put back in place to make sure that it's not widespread. Or you're going to see the other side of it not continue to have a large amount of community spread. And after 14 days or so, or maybe longer, look at reopening other areas as well. So that is the thing of, it's a hard decision to make, and that's why you see the struggle right now at the state level with the legislature and the governor, is because you literally are trying to decide, without having all the data in front of you, what's going to happen if we start opening some of these things up, and no one knows the answer. So it's literally, you have to try it and see what happens and how far that spread goes, and be ready to respond to it. And be ready to either contract or open more areas up. And no one will know until we start doing that at a state and local level.
Appreciate the call. Thank you very much. 395-1450. One thing that I don't want to say I'm harping on this on the air, but I've been pretty much consistent about mentioning is the mental toll that this has taken, not only among those of us who are, right now stay home, stay safe, but really for you first responders that you're waiting in, and this is not just a week or two. This is an extended period, 6 weeks, 8 weeks, maybe 10 or 12 weeks before we can start seeing a break. And it's got to take a mental toll. How is as leader in first responders, Nick, in that regard, how are you addressing those type of situations?
Yeah, so we're really looking at it on two different fronts, and we track it on a daily basis here. And the two fronts that we're talking about are, one, the obviously uptick in cases out in the community. So we look at numbers of domestic related incidents in the community, and we make sure that those numbers are staying within a reasonable bounds. And we definitely have seen a uptick. You've seen Captain Bennett here from the Ottawa County Sheriff's Office discuss that. Internally here within the first response community, obviously these are stressful times for a lot of folks, and making sure that they have the mental health support that they need, both through internal organizations and external organizations. And that's something that we continue to communicate on a daily basis. And it's basically just a checkup of every individual organization in response and making sure that everyone's taken care of. So we need to take care of those that take care of us, for sure.
We'll put a link to the emergency management page on myottawa.org when we put the audio podcast of our conversation, Nick Bonstell, on our website at WHTC.com. Nick has been gracious enough to let us record our Zoom conversation. We'll put the video up on our Facebook page at 99.7 and 1450 WHTC up a little bit later on today. Nick Bonstell, I want to thank you very much for joining us today on WHTC's Talk of the Town program during this stressful time, spending some time with us, and hopefully we can talk, if not before the end of this, afterwards under maybe better circumstances. Nick, thank you.
Thank you, Gary.
And that is Nick Bonstell, the Director of Emergency Management with the Ottawa County Sheriff's Department. WHTC's Talk of the Town will resume following the 10 o'clock news block. We do have Deborah Rodriguez coming up in a few moments with the CBS News, followed by Peg McNichol with WHTC News, and then some open line time. Bottom of the hour, Patty Vandenberg, what's new around Holland? And then we'll be joined by Alyssa Lanyons of the Day Center of Evergreen, the Evergreen Commons monthly update. And a little after 11, Governor Gretchen Whitmer will tell us how much longer stay home, stay safe will be extended, as well as maybe some changes to it. Press conference a little after 11 on WHTC.